Hi guys, and welcome back. In today's episode, we're going to talk about another SIBO symptom, inflammation. Now, of course, we're going to have a primer on why it happens, how it happens, and then what you can do about it. And we're going to talk about the different flavors of inflammation, which I feel like is a very important topic to start us off. So first and foremost, it probably drives you all nuts. It drives me nuts on some level. But have you noticed how people in the internet and healthcare professionals talk about inflammation like it is one single entity, right? Like we don't talk about the flavors of it. We just talk about inflammation. But you can be inflamed for many different reasons, and you can have different styles of inflammation. So for some people, inflammation is going to manifest as joint pain. Some people will have brain fog or fatigue. Some people might have eczema or skin issues. Some people might have more local gut dysfunction. Some people might have really awful, miserable periods. It really runs the gamut because no tissue in your body likes to be inflamed, but inflammation is a protective response. You actually need inflammation in order to kill microbes and manage your risk of infections. If you didn't have any inflammation in your body and your body was incapable of inflammation, you would die very quickly. And similarly, we all think of pain as a bad thing, but if you didn't have the ability to perceive pain, you would probably die much earlier without that protective mechanism. So in excess, both pain and inflammation are very unpleasant, bad things, but in just the right levels, they are very protective and necessary for human life. Now, going back to the idea of the flavors, here's the best way that I teach my patients about inflammation and the best way I can wrap my head around it. Inflammation is kind of the equivalent of us saying soup. It kind of paints a picture. You could start to wrap your head around what soup actually is, but you and I both know that there are many types of soup, right? You could have minestrone, you could have lobster bisque, you can have, I don't know, like, are those the only ones I know? Tomato soup, you can have chicken soup, you can have chicken noodle soup. There are 8 gazillion different flavors of soup, but we still can lump them in and call them soup. So as this comes up in healthcare, what I've seen is that there are inflammatory markers, say like C-reactive protein, that oftentimes doctors will measure. And then if that comes back normal, they will tell patients, oh, you don't have inflammation, you're good. Well, that is one of the soups. They might as well say, you don't have tomato soup. But it's not to say you don't have soup. There could be another type of soup that we are just not measuring. So for example, you can have inflammation of a particular variety because you are deficient in B vitamins. You can have another type of inflammation that relates to the thyroid. You can have inflammation that manifests as autoimmunity and your immune system making antibodies against a tissue. You can have inflammation that is local to one tissue but not the others. So you could have joint inflammation in just one joint, but the rest of your body is not inflamed. There are so many different flavors and so many different chemicals that go into making that soup. It's like the ingredients in a soup. There are 8 gazillion different ingredients that can make 8 gazillion different types of soup. And if we are stopping short and just measuring one of those ingredients and then saying, you don't have soup, we're kind of not seeing the entire clinical picture. So keep that in mind throughout this conversation, is that there are numerous different chemicals that signal what we call inflammation, and then that inflammation can manifest in numerous different tissues in numerous different ways, and some of that is going to have a genetic component to it, like maybe, so for me, for example, my family, chock full of celiac genes and chock full of Hashimoto's. So if I become inflamed, I'm more likely to manifest Hashimoto's or celiac disease, as I do, as opposed to like gout, as an example. Like maybe genetically that's a little bit more in the cards for me to go down that celiac Hashimoto's road as opposed to that other road. So there's a little bit of individuality, there's a little bit of genetics, but I think we all are capable of having inflammation. It's just what path you go down. So all of those numerous metaphors aside, let's get started and we'll talk about what actually ends up happening and why people with SIBO frequently will have some degree of inflammation. Again, it depends where we're talking about and what type, but inflammation nonetheless. So recall my beautiful diagram of the human digestive system. You have your mouth, esophagus, stomach, small intestine, which is the biggest portion of your digestive tract. and then your colon, aka the large intestine. And recall that in a normal situation, most people will have a colon that is chock full of bacteria and yeast and parasites and viruses and methanogens and all sorts of good stuff. All the creepy crawlers live here, or the vast majority. And then there's a speckling, a dusting of bacteria throughout the rest of the digestive tube. So no part of your body is sterile. It's just that there are far fewer bacteria in the small intestine as opposed to the colon. But for the unlucky person who has SIBO, you end up having an increase in quantity of bacteria, and there's usually some dysbiosis. There's usually a propensity to having more of the quote-unquote bad bacteria and less of the quote-unquote good bacteria as it pertains to this overgrowth. So keep in mind, overgrowth, the O in SIBO, doesn't tell the whole picture. It really should probably be called small intestinal bacterial dysbiosis, or maybe small intestinal microbial dysbiosis, but SIMD doesn't really roll off the tongue in the same way that SIBO does. Nonetheless, I digress. Hashtag SIMD. So we have an increase in the number of bacteria and usually an increase in the so-called bad bacteria in the small bowel of people with SIBO. And then that can lead to unpleasant symptoms like we've talked about, like pain and bloating, FODMAP intolerance, even things like anxiety via the vagus nerve and elsewhere. If we were to zoom in on a portion of the small intestine, then we would get this little picture behind me. So now what we're looking at is we've zoomed in way, way, way close, and we have all of the food in the middle of the intestinal environment called the lumen, the center of the tube. You have a nice mucus lining that adheres to and protects the wall of your gut. You have the epithelial cells that protect you and form the physical barrier. Think of like a picket fence between you and the neighbor's yard. But in this case, the neighbor's yard is your food and your bacteria and your mucus. And then on the other side of that picket fence, on the other side of this world and that barrier, now we have the immune system. And remember, about 70% of your immune system lives here. The immune system lines this tube all the way down to a point where 70% of your immune system lives there. Not in your lymph nodes, not in your spleen, not in your bone marrow, your freaking gut. And that, my friends, is why SIBO can cause so much inflammation. So, as an example, we'll look at the immune system a little bit and the general premise of what will happen. But you might be asking, all right, so we have food and microbes, mucus, gut wall, immune system. What comes next is your bloodstream, your blood vessels, your lymphatic vessels, arteries and veins, and then that, of course, is the highway to the rest of your body. If something gets into the bloodstream, now you have free access to the liver and potentially other tissues, depending on how good of a job the liver does at trafficking this. So if we think about this, the immune system, they're kind of like the equivalent. If we said that these gut wall cells, the epithelial cells, are like a picket fence, the immune system is kind of like an army of dogs that are trying to guard the yard and guard the house. The bloodstream is the house. You don't want bad guys to get in the house, so your body intelligently put a nice big picket fence and then a whole bunch of guard dogs. And they are going to yap at and nip at anything that they think is a perceived threat or a danger signal. So what that ends up being is that, say, for example, we have gut inflammation or dysbiosis. Say, like, here's a bacteria in orange. Say that a bacteria gets through, or perhaps a bacterial toxin or a yeast toxin, something like that, gets through to the gut. Well, the immune system can respond in a couple of different ways. It can engulf that bacteria, right? It can just wrap itself around and phagocytize that bacteria or that yeast. If something is too big, then that's not going to happen. But for bacteria, that can certainly happen. Or, actually, or would be more appropriate here. Now the immune system, even if it's going to phagocytize this bacteria and bring it into the cell, it wants to send out a signal, just in case the shit is really hitting the fan. The immune system needs to know, hey, I just engulfed a bacteria. This shouldn't happen. we've got Mayday, red alert, we need to send out the SOS signal. So now this immune cell sends out chemical signals to neighboring nearby immune system cells and says, help, SOS, Mayday, red alert, oh my God, OMFG, we have something to deal with here. And that way these cells can come in, check out what's happening. If one of these fragments is around and they think, oh, we actually have a problem, then one of these cells will carry a fragment of that bacteria or virus or pathogen, and it will carry that fragment to other cells in the lymph nodes to say, hey, check this out. Do you think this is a problem? We think it might be. So they will present that antigen. But all of this taking a fragment of that critter or that toxin, presenting it to the immune cells elsewhere in the body, all of these chemicals sending out SOS, Mayday, red alert signals, all of these are things that are associated with the inflammatory response. And again, it could be a good thing. The inflammatory response is making sure that this bacteria doesn't give you sepsis and kill you. It's making sure that if there's a gut breach, you can patch that up before more bacteria comes in. It's intrinsically part of the healing process. It's just that when these inflammatory chemicals and when these activated immune cells get out into circulation or out into a body part, it can create unpleasant symptoms. But really, it is your body waving a bit of a flag saying, hey, we need some help. Please come over here and help me manage this because I'm kind of nervous. I think it's going to be a big deal. So now let's shift gears a little bit and I'll share with you twofold. There are two distinct layers of inflammation that I think are particularly relevant for people with IBS and SIBO and dysbiosis, and those are local gut inflammation and more broad systemic inflammation. So let's start with the broad systemic stuff because we're kind of on that tangent first. So say some of these inflammatory Mayday SOS signals get out into the bloodstream, and now the SOS signal has been sent broadly to the entire body. Or say some of these activated immune cells who now have antigens to present, let's say that they get into the bloodstream and now they're off to the races and they're going to present their antigens. That can manifest as systemic inflammation. So these are going to be the people typically who will have measurable levels of inflammation on blood work. So if you have ever had elevated C-reactive protein, elevated homocysteine, glyce-A, sedimentation rate, even things like elevated ferritin and elevated platelets can be indicative of an inflammatory response. Liver enzymes, GGT, the list goes on and on. Did I mention glyce-A? I don't remember if I mentioned glyce-A and reverse T3. There's a lot of different flavors of inflammation we can measure in blood, but that, if one of those or more of those are elevated in your blood work or in a urine test, for example, then you can be reasonably sure that you have some degree of systemic immune activation and systemic inflammatory response. And then you're going to want to address that because guess what? Not only does the gut not really appreciate a tremendous amount of inflammation, but your nervous system really, really does not. And if you want your gut to work, you really need your nervous system, specifically the vagus nerve, to be in tip-top shape. And if you have boatloads of inflammation flaming out your vagus nerve and flaming out your nervous system, you're going to have a really hard time overcoming something like SIBO and getting your motility to work. So if you have this broad-reaching systemic inflammatory response, if you have things like fibro, chronic pain, joint pain, rashes, autoimmunity, if you have things like that as part of your SIBO presentation, then we need to start treating that. So this is where anti-inflammatories like turmeric, green tea, resveratrol, quercetin, there's a million of them, boswellia, there's so many different herbs and so many different foods and spices that have an anti-inflammatory response, and you might need to take copious doses of those, potentially for weeks or months, to really get this to quiet down. The other thing, of course, is that if we can just help the immune system fight off these pathogens, if we can correct the SIBO, if we can treat it and get your motility running again, then your immune system will have less of a reason to be chronically freaked out. So treating the SIBO is going to be intrinsically anti-inflammatory. But oftentimes I find with my patients that you need to do a little bit of both. If you have that widespread inflammation, you need to be doing anti-inflammatory things and treat the SIBO, promote motility things, not just one or the other. Now, the other piece that I'd like to share is that you can have inflammation that is more so residing in one tissue. So like I said, you could have inflammation in one knee joint and the entire rest of your body is not inflamed at all. That is entirely a possibility. It happens all the time. But that can happen in the gut too. So you could have a raging case of SIBO and you can check all of the inflammation markers and they could all be normal. And then you could go to a doctor and have them say, you don't have inflammation, you're good. Well, no, it's just, you probably do. It's probably just localized to the gut, in which case you're going to want to really focus your efforts here. So one great example is if you're trying to treat something like joint pain or fibro or chronic fatigue, you might choose to take a turmeric supplement and you might choose to get one of the fancy schmancy, super expensive emulsified ones with the piperine black pepper extract for maximum absorption. But if you're trying to treat gut inflammation local to the gut, maybe you don't want all that turmeric to be absorbed. Maybe you want the really shitty, non-absorbable stuff, and you want to take it in copious doses so that more of that turmeric has a chance to hang out in the gut as opposed to going about it with the intention of having it absorbed. So oftentimes, as an example, I'll have patients just get plain old turmeric powder, like the spice, mix it with some coconut oil, and take that down by the spoonful, as opposed to getting some fancy schmancy $80 or $90 extracted turmeric curcumin supplement, where the goal is that we want that turmeric to get absorbed into the bloodstream and then do its anti-inflammatory stuff, right? So there's two different goals. If you have the systemic type of inflammation, by all means, get the fancy schmancy turmeric, get all of the anti-inflammatories on board. If you want to target gut-based inflammation exclusively, then you could probably get away with some of the cheaper stuff, or just working on the microbes and the dysbiosis and the leaky gut, and then those will have local anti-inflammatory effects, and then you're golden. So lots to talk about. I could probably talk about inflammation as it relates to the topic of gut health. I could probably talk about this for 3 hours, but I want to keep it more to the point than that. I don't want to put you to sleep. I really hope that this was helpful in understanding why inflammation happens with SIBO, and more importantly, what the different flavors are, help you get that understanding, and then give you some insight about how you might treat one versus the other versus another. Because you all got soup. It's just a matter of where the soup is and what kind of soup you have, but I say this with love, you all have soup if you're watching this video. Thank you so much, and I'll see you in the next one. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.